My name's Peter Wafula Nasokho. I'm M&D Associate for the malaria program in Kenya.
Peter, how long have you been with the Measure Evaluation Project?
I have been on the Measure Evaluation Project for a period of 6 months now.
Excellent.
Yeah.
And how did you come to the Measure Evaluation Project? What did you do formally before coming?
Previously, I was working with an organization called RTI International and was a monitoring and evaluation specialist on that program for a period of 2 years.
Okay. And what do you currently do for Measure Evaluation?
Currently, I work on the malaria program in Kenya for which is supported by Measure Evaluation, and my activities are on surveillance systems in Kenya, that is improving the malaria surveillance strategy, implementing the WHO guidelines on malaria surveillance.
How are you implementing the WHO guidelines on malaria surveillance?
What we do is we work with, I work with the Division of Malaria Control in the Ministry of Public Health to support them implement and adapt the malaria surveillance strategies that from the WHO.
Okay.
Yeah.
And tell me more about the malaria surveillance strategy. Can you explain that for me?
This is a new concept whereby my work is to help the Division of Malaria Control adapt the malaria surveillance strategy from the WHO. This is from this workshop that happened in Rwanda in the year 2011, whereby the country, Kenya as a country, adapted the core surveillance graphs that they are to use to implement the surveillance strategy in Kenya. Before that happens, what we are doing now is to make sure that Kenya is prepared to have is prepared and has the information that needs to go into the surveillance. What we have done now is we have developed a kind of a pilot study, which is is currently ongoing, to demonstrate that this information is available. And this information actually comes from the facilities, from the facility level, that is the health facilities at the community level. So we have to go into the community, collect this information, then analyze that information to show the trends of malaria in Kenya. We are collecting the information about the malaria suspected cases, the number of cases that were tested and came out positive. This is from use of RDTs, and these are rapid diagnostic testing and microscopy. And then the number that were positive and were actually treated according to the malaria guidelines. This is using the ACT medicine for treatment of malaria in Kenya. So those are some of the indicators that we collect to feed in. And then the number of deaths from malaria, the cause of death is malaria. The number of children who have received, this is under 1 year, who received nets. The number of mothers who attend ANC, antenatal clinics, and were given the IPTP for prevention against malaria. How many mothers attended ANC and received insecticide-treated nets? These are LLINs, information like that.
So when the data is collected and the information is collected, where does it go?
The data is collected from the facility, and then the information is sent to the district, and then the districts aggregate this information and then send the information to the national level. What is there is at the district level, there is analysis of this information to make sure that whatever the information, the data they are getting from the facilities actually is reflects the populations and projections of that facility.
Okay. And have you seen the data that has been collected that goes all the way to the national level used in any case?
Yes, this data is so much used to inform in case of malaria outbreaks. This is in epidemic zones, and also it is used to inform the districts on the malaria trends and to focus on either maybe if they need to order for more drugs for treatment, if they need to order more nets to give to the antenatal women attending ANC, so that there is no stockouts of that. We train malaria focal persons from the national level, which you call the central level, to the district level. We have trained 54 focal people in Kenya on monitoring and evaluation so that they can understand how to run a monitoring and evaluation program and also define information and use that information at their specific levels.
Is there any form of continuing learning? Are people in contact with each other?
There is material that we give to them to take home from the training, and then there is kind of a follow-up from bringing them, like the pilot study we are doing is from those districts and provinces that we trained on the M&E. So there is also interaction between the individuals, just to maybe learn from each other and what kind of activities they are doing. There are so many other surveys that are going on within those same districts. Like for example, the survey on LLIN distribution that was done prior, just to follow on coverage and usage of the LLINs. So there is that kind of information that they also continuous interaction. On top of that, we are planning a post training survey or study just to understand how they have used this information. The training that I'm talking about happened in August 2011. So 6 months after that, we are also planning to follow up and make sure, understand how they gained the knowledge, what the retention rates are, and how they are using this information or training to improve their day-to-day work.
Can you tell me a little bit about how knowledge management might impact your position particularly?
There are so many activities that go on, and how I think what is missing is not so many people know about these activities. So knowledge management, I think, will help my activities to kind of focus it towards the relevant groups that we gain from the knowledge, from how we have implemented activities, what information have we generated from every activities that we've carried out here, and sharing that knowledge with other internally and externally to other stakeholders in malaria.
Excellent. And this is my last question. Since you've been on the Measure Evaluation Project, what improvements have you seen, or how have you seen Measure Evaluation have a positive impact on Kenya as a whole, on the country?
One thing I look at is mainly capacity building. It's very important that as Measure Evaluation, we are providing technical assistance and also capacity building towards the ministry and the personnel who work in the Ministry of Health. That's the Division of Malaria Control and their focal persons at the division, at the district or provincial level. You could see the enthusiasm of these people gaining knowledge on how to use the data that they are collecting, how do they write the reports, how do they give feedback to and share the knowledge within each other at whichever level that they have.
Excellent. And are you does your work with Measure Evaluation keep you interested, keep you excited?
Yes, it does a lot.
How so?
I mean, the thing is, having to work through people and making sure that people have knowledge of whatever that you do so that they can do it even better is more very encouraging, and it actually excites me a lot. And training them, sharing knowledge, things like that. Yeah.
Excellent.
Yeah.
Well, Peter, thank you so much.
Okay.